at the Canadian Cancer Survivor Network. Thank you for coming to our webinar today, and it's called The Impact of COVID-19 on Cancer Patients and Their Ability to Receive Treatment. I'm pleased to welcome Marjut Huotari, who's the Vice President of Healthcare Insights at Gilead. Marjut had received her MBA from Gilead, and she's been in market research for 15 years. She's a really big dog person and has not big dogs, but very much a dog person. And she has, I believe, a poodle and a boxer. I hope they get along.
Very much so.
Thank you. Okay. So a little bit about today's webinar. The COVID-19 pandemic has put cancer patients in the untenable situation of limiting access to essential cancer care, including tests, treatments, clinical trials, and at the same time having to worry about contracting COVID-19 in their immune compromised condition, like we're all worried. To assess the extent to which disruption of cancer care caused by COVID-19 in Canada is impacting cancer patients and their caregivers, we at the Canadian Cancer Survivor Network engaged Gilead, an independent and wonderful market research agency, to conduct a national survey of more than 1,200 cancer patients and caregivers across Canada. At the end of the presentation, our speaker will answer your questions. However, at any time during the webinar, feel free to type your questions in the chat section on your right hand of your screen, the bottom right of your screen. For those of you who have not been with us for one of our webinars previously, CCSN is an organization working with cancer patients and survivors to learn about the health system complexities, connect with others to plan action, and act to promote best care and healthier survivorship. If you want to learn more about CCSN, find us at www.survivornet.ca. The webinar is being recorded. It'll be available tomorrow on YouTube, and the slides will be available on SlideShare. Links to both will be sent to the email provided by the registrants. Now I'll turn things over to our presenter. Welcome, Marjut.
Thank you, Mona. I really appreciate this, and Gilead has really enjoyed working on the study for you. Gilead in the last, since COVID started, Gilead has done a weekly survey as well to look at the impact of COVID on Canadians. And here we're helping you look at the impact of COVID on cancer patients and their ability to receive treatment. So can everyone see my screen?
Yes.
Okay.
Okay.
So overall, as Mona said, we're looking at the impact of COVID on cancer patients and caregivers. So here, what we're going to talk about today is what were we really trying to do with the study? What are our objectives? How did we do the study? How did we recruit these patients? And how did we get them? What did we find, and some conclusions? And then there's a question and answer session at the end for everyone to participate. So in terms of the research study, really is really looking at, as we know, COVID has had an impact on everyone, not just cancer patients, but Canadian Cancer Survivor Network, with support of Aid Advocacy Solutions, hired us to help them understand to assess what the impact has been, the extent to which the disruption of cancer care caused by COVID-19 is impacting caregivers and patients both from an emotional and a physical wellness perspective. So really the key issues and things we addressed here we're looking at the physical things. Have appointments been canceled or rescheduled? Have they had appointments for treatments, for surgeries canceled, rescheduled? Really, what really has happened? Have there been delays in diagnosis? So are patients awaiting the results of a test to confirm a diagnosis of cancer, to confirm if cancer has come back, has done anything? They're looking at biopsies, ultrasounds, etc. So they're looking at what have they done in delays. And also we wanted to find out, in this time we've heard in the ERs, our emergency rooms are not always as busy right now. We've heard news reports about that. We asked patients, have they actually avoided going to the emergency room, even though they should have if they've had symptoms related to their cancer diagnosis? So what overall have the emotional and mental impacts been on their diagnosis and treatment. So having these delays, what's been the emotional and mental impact? And during this COVID-19 crisis, what's been happening with their doctors and they're interacting with their doctors in managing their cancer from a patient and caregiver perspective? Are they going to see their doctor still in person? Are they using virtual consults such as telephone, online, webinars, whatever? What's happening there? And we also wanted to know, as we know with cancer patients, that clinical trials sometimes are the only way they can get certain treatment. So we wanted to find out for those who are participating in clinical trials, has their participation been affected? Has the trial been stopped? Has it been put on hold? What does that mean? So what we're doing here in the study is looking at all these aspects of looking at physically what has happened and what does that mean for them mentally and emotionally. So in terms of who we spoke to across Canada, we spoke to 1,243 Canadians, of which the bulk of them, 960 Canadians, who were diagnosed with cancer, 206 caregivers of patients with cancer, and 77 Canadians in that pre-diagnosis stage. They still don't know yet if they have cancer, but they have signs and symptoms that may show that they do. So they're in that stage of trying to find out, determine, is this cancer or is it not cancer? And that we made the survey available in both English and French. And we did the study in end of May 22nd to June 10th is when the data was collected, so still during the height of COVID. And when we looked at who we spoke to across Canada, you can see we've got really great representation across Canada. As always, Ontario, Quebec being the largest samples that we have, 35% from Ontario, 33% Quebec, followed by BC and Alberta, big samples. All of Atlantic, 6%, and then Saskatchewan, Manitoba, 2% apiece. So really good regional representation across Canada. In terms of recruitment, the vast majority of the patients were recruited by Leger's panel Leo overall, which is the largest Canadian panel in Canada, with most of the patients, almost all the caregivers and all the pre-diagnosis patients recruited through the Leo panel. And we also had the opportunity to use the post a survey link on the CCSN website, through which we got 51 patients and 1 caregiver. So good numbers for patients, caregivers, and pre-diagnosis. And who were we looking to talk to in this study? We're looking to talk to Canadians living in Canada who are 18 years and over, and they were qualified as a patient if they were diagnosed with cancer currently. They're diagnosed with cancer. They qualified as a caregiver if a currently living family member or someone they're caring for has been diagnosed with cancer. And pre-diagnosis are those if they're in the process of trying to determine if they have cancer or to rule out if they have cancer. And we set a limit of 35% of patients to be in remission because we wanted to talk to those patients who are actually more so in active treatment. But we wanted to include remission because that is a key stage of the cancer journey as well. When we talked about the patients, who are those 960 patients? Here's a little quick summary of all the different patients. So we had a good split between males and females, just slightly almost even, 52% females, 48% male. Again, as we saw across the whole study, and because 960 of the respondents were patients, you can see here these numbers mirror the regional representation across Canada. So very good representation from across Canada. We looked at how old were the patients, and here we see that patients tended to be a bit older. The average age of the patients that we talked to was 59 years of age. And we looked at where were they in Canada? Were they in a rural area? Were they in a smaller town city? Were they in an urban metro area such as the Greater Vancouver area, Greater Toronto, Greater Montreal? And you can see here that we had a good mix of respondents from across all different areas. We also, if they had cancer of any kind, we included them in the study. And when we looked at the types of cancer that people talked about that they had, we can see here that breast cancer and prostate cancer were the 2 biggest cancer types that the patients reported. And those 2 represented about half of all patients. And then we looked at other cancer patients, other types, about 1 in 10 also had colorectal, melanoma, lung, and bladder as well. So we had a good mix of patients across everything, including the blood cancers, lymphomas, leukemias, etc. And we looked at where they were in their cancer journey in stage 1 of cancer, 2, 3, which is also the adjuvant stages. You can see that about half of the patients were in stage 1, 2, and 3. In terms of stage 4 metastatic, about 10% were in that stage 4 metastatic, and 35% of patients were in remission. We also, some people say, I don't really know what stage of cancer I'm at, so we always have that group as well. And how long has it been since they were diagnosed with cancer? And it varies greatly, but we saw that a majority of the patients who responded to our survey were actually diagnosed within the past 5 years. 30% less than 2 years diagnosed, so recently diagnosed patients, and another 35% who'd been diagnosed within the last from 2 to 5 years ago. So good mix of people across from less than 2 years to greater than 10 years. We talk about the 206 caregivers. What do they look like? What does a caregiver look like in this study? So there's slightly more females to males, 60% females, 40% males. Good regional representation, again, Ontario, Quebec with it being strongest, followed by BC, Alberta, and then Atlantic with Manitoba, Saskatchewan then. We had a good mix of ages, but as we saw, the average age of patients was 59. The average age of caregivers was 47, so slightly younger. And also in terms of population, you can see again, really good mix, about almost 20% in rural areas, 56% in towns and cities, 24% in urban metro. So a good mix across the different types of areas they can come from. And what was the type of cancer that was the person being cared for was suffering with? You can see that breast cancer, 34%, colon rectal cancer, 20%, lung cancer, again, 19%, prostate cancer, 13%. Those are the top 4 cancers that patients reported. But again, these patients had everything from different blood cancers to melanoma, myeloma, etc. So there's a whole mix of things that the types of cancers that they were suffering from. In terms of what stage of cancer the patients were at, you can see again, stage 1, 10%, stage 2, 23%, stage 3, 16% were metastatic or stage 4, and we had less patients or caregivers with patients in remission, only 23% here versus 35% of those patients were in remission. And again, we had some who said they weren't sure of the stage of cancer. And how long has it been since they were diagnosed? With this group, we actually had half the patients, half the caregivers say the patients were diagnosed in the last 2 years. So we had a lot of recently diagnosed patients that these caregivers are looking for, and another 27% in 2 to 5 years. And who were these patients in relation to the caregivers in relation to the patients? You can see that about almost a quarter, 23% were a spouse or partner, 19% was a daughter or daughter-in-law, 10% was a mother or mother-in-law, and another further 10% was a son or son-in-law. And there's others as well, but these are the main ones that we saw in terms of relationships. So this gives you an idea of the patients and the caregivers. Next, we'll look at those 77 who are in pre-diagnosis. What does a pre-diagnosis patient look like in our survey? You can see that in terms of sex, it skews towards males. 2/3 of the patients in the pre-diagnosis mode were male. Here, in terms of pre-diagnosis, we had more in Quebec, 48%, followed by Ontario, 32%, then Alberta at 12%. So you can see it skewed more towards the majority from Ontario, Quebec. In terms of age, the pre-diagnosis patients are younger than both the patients and the caregivers. 75% of the pre-diagnosis patients were under the age of 55, with the average age being 46 years. So under 50 years of age is the average age for those in pre-diagnosis. In terms of where they live, you can see that more so in urban metro versus the patients and caregivers. So 32% in a metro urban area, such as Greater Toronto area, Greater Montreal area, and less so in the rural areas. And where are they as they await their for a possible cancer diagnosis? What have they done? 49%, almost half, have already talked to their family doctor about signs and symptoms. And 48% have been referred for further investigative tests. and 18% have been referred to a specialist for further investigations. And these are not mutually exclusive. Some people may have been talked to a doctor and been referred, so that's why the numbers don't add up to 100. So there's many different steps they could have been through already. So what did we find? Overall, I'm just going to give you a quick summary of the top findings we're going to have here, and then we'll go through the data more directly. So overall, when we saw the results of the study, what we did find, and you'll see through the data, is that the restrictions that have been put in place to manage the COVID-19 crisis have really resulted in considerable disruption to many aspects of cancer care in Canada. Despite consulting doctors using virtual modes of interactions, and most likely most said telephone, delays in appointments and treatments has had a major impact on patients and their caregivers. They're seeing the doctor, but they're still having major impacts. And the many disruptions to cancer care have taken a mental and emotional toll on patients and caregivers. And the concerns about receiving adequate cancer care both during and after COVID-19 are fueling anxieties amongst these patients and caregivers. It really has had an impact. So when we look at the actual data, when we look at the data in terms of what physically has happened to them first and then going through emotionally, when we look at have they had appointments canceled, postponed, or rescheduled, we'll look at them, and some of the things that I'll show through the data is that those who are in the pre-diagnosis and recently diagnosed have had a more impact than other patients overall. So we looked at those patients who reported having canceled appointments, postponed appointments, or rescheduled appointments, either by the doctor or themselves. Overall, across all three groups, the patients, the caregivers, and the pre-diagnosis patients, just over half, 54%, said that they've had some kind of cancellations, postponements, or rescheduled. When we looked at patients specifically, half the patients said that this has happened to them. But when we looked at those patients more depthly, when we looked at those recently diagnosed, those who've had a diagnosis in the last 2 years, 68% of those said that they've had appointments canceled, postponed, or rescheduled. So significantly more those recently diagnosed than overall patients. And caregivers, when we look at caregivers, 66% of them report appointments canceled, postponed, or rescheduled. And again, more so among caregivers of patients recently diagnosed, with 85% reporting this has happened to them. And we look at the pre-diagnosis, 74% of the pre-diagnosis patients overall have said that they've had appointments canceled, postponed, or rescheduled. Think of the patients, and if you think about just looking at these are the numbers of what happened to them, we get to the emotional, you'll understand what this has done for them. And also we asked about, have you visited an ER for symptoms? You should go to an ER. Have you avoided visiting an ER? 16% overall said they've avoided going to an ER. Patients, 12% overall, but again, recently diagnosed, those with less 2 years, 22%, even though they should have gone to an ER, said that they have not. From a caregiver perspective, 26% said the patient they care for has avoided going to an ER, more so again now in the metastatic stage. So those in a stage 4 metastatic cancer have avoided going to an ER. And as anybody in this time and knows, the ERs, seeing the reports on TV, ERs were less busy during COVID than they anticipated. And those in a pre-diagnosis, those who haven't got a diagnosis of their cancer yet, 40% said they avoided visiting an ER, even though they should for signs and symptoms. And then finally, when we look at this page, have they had surgeries or procedures canceled? Overall, 15% have said that they've had surgeries or procedures canceled, 12% for patients. But again, as we said, those recently diagnosed, less than 2 years, 22% had surgeries or procedures canceled. Caregivers, 23% overall reported procedures canceled. And one thing we noticed here as a difference was we looked at people who lived in rural areas, we looked at people who lived in the city, small cities, the greater Toronto regions, things like that. When we looked at those who are living in a rural area, significantly more caregivers reported that their patients, 31%, had had surgeries or procedures canceled. So it's had an impact more so in the rural areas for caregivers. And in terms of pre-diagnosis patients, 30% had surgeries, procedures canceled. And if you are a pre-diagnosis patient looking to find out if you have cancer or not, and you have something postponed, and you're trying to find out if you actually have cancer, that can have a mental and emotional impact, which we'll show shortly. And in terms of, did they have any delays in receiving treatment? What we saw here was, again, those recently diagnosed patients experienced delays. Overall, when we looked across all three groups, the patients, the caregivers, and the pre-diagnosis, or here was just the patients and the caregivers, 11% experienced delays in starting or continuing treatment, 8% of patients. But again, what we saw earlier was if you've been recently diagnosed, you had a more likelihood to getting a delay in treatment as well, or continuing delay in starting or continuing treatment. And 23% of caregivers reported that their patients had a delay in starting or continuing treatment. And this was more so, again, in those recently diagnosed and living in rural areas, 32% there. So you've had an impact on actually starting, continuing your treatment if you're a cancer patient or caregiver. We also looked at clinical trials and what happened with clinical trials. We found that 4 in 10 patients who were enrolled in or in the process of being enrolled in a clinical trial report that the clinical trial was put on hold altogether. So as we all know, sometimes clinical trials are the only way some of these patients can get treatment. So 4 in 10 said that they had been that the clinical trial was put on hold or stopped altogether. And this was more significant for those recently diagnosed. 6 in 10 recently diagnosed reported a clinical trial being put on hold or stopped. And we looked at those in the adjuvant stage, those who are in stage 1, 2, 3 of cancer. 5 in 10 of those said that their clinical trial was put on hold, and 4 in 10 in the metastatic stage. So this really helps highlight that there has been a significant impact on patients starting, continuing treatment, or being able to access newer treatments through clinical trials through the COVID-19 crisis. And we asked them about the impact on their mental and emotional health. Overall, 72% across the board, the patients, the caregivers, and those in the pre-diagnosis stage said that delays in appointments has had a major impact on their mental and emotional health. So what we asked was we had them write out their state. How did it feel when we asked them? So many were worried, they're concerned, anxious, stressed. So they had a huge, major impact on mental and emotional health through delays and in appointments. We looked at the patients overall, 74% overall, but 68% of patients said they had an emotional impact. This one quote from a patient that wrote in: "First, I would like to say no one should have any cancer appointments canceled or rescheduled. This is cancer. It may even already have spread. Not having my treatments is a nightmare. All you keep doing in your head is asking, has it spread? Am I going to die sooner? Will I make it to my next appointment?" These are the types of fears that patients told us through the survey they were experiencing. Another patient said, "I'm supposed to have testing done at every appointment. I've been put off for 3 times since COVID-19 started. I'm worried that I may still have growing cells. I was also supposed to have a CT MRI as well, but have heard nothing on a date, canceled or otherwise." So what's happening? Think of the emotional state these patients are in with these cancellations. So we said 68% of patients, caregivers more so were worried than the patients, 89%. Almost 9 in 10 caregivers reported being concerned or having an impact on their emotional and mental health. Here's a quote from one of the caregivers. "I was worried as our appointment was scheduled for the end of March. We tried to reach the doctor and it was concerned that their voicemail was always full. It wasn't until that week that we found out the appointment was canceled. So not knowing can I or can I not go see the doctor, will I have an appointment or not, has a huge impact on patients." Another caregiver said, "It was really stressful because the day appointment was fixed, all plans and everything was scheduled. But when it is postponed, then you have to schedule again and change everything. Think of those patients who need to have organized, if they live farther away, organize somebody to drive them, get them here, get the blood work beforehand, do this, do that. And all of a sudden you've done everything, you've got it all set up. And at the last minute, you can't do that. So then you have to undo everything you've done, stop your ride, etc., and redo it again. That adds stress to a patient's life or caregiver's life. 82% of those in pre-diagnosis reported a major impact on their mental and emotional health. Here's another quote from a pre-diagnosis patient. Having the doctors postpone and cancel my appointments and treatments makes me a bit worried because I'm scared that what if it spreads during the time being without noticing? Here you are, you said you may have cancer, but you can't come see me. What does that mean from a pre-diagnosis patient's perspective? Another pre-diagnosis patient wrote in, I'm a mess. Not knowing is driving me insane. I can't think straight, I don't sleep, I don't eat. Mental, emotional anguish for patients, and especially those in that pre-diagnosis stage. And when we looked at fears for the future, they're most pronounced, as we saw, those recently diagnosed, pre-diagnosis, and also in the metastatic stage. So when we look at the numbers, we see that 56% express fears for the future. We asked, COVID-19 has affected most aspects of everyone's life, causing fear for the future and increased level of anxiety. So 56% express fears for the future. When you look at patients, 51% overall. But when you look at those who are in the recently diagnosed, 2/3 of those recently diagnosed express fears for the future. And 2/3 in metastatic stage also express fears for the future. Caregivers, again, higher fear for the future, 73% overall. And again, much higher for those caregivers of patients recently diagnosed, 76%. And almost all caregivers of metastatic stage patients are fearing for the future. What do we do now? And 74% of those in the pre-diagnosis stage as well. 55% overall had an increased level of anxieties overall. We looked at patients, 49%, and always the patients overall is lower than everybody else, which is always interesting to see. But again, if you look at patients recently diagnosed in the metastatic stage, almost 2/3 there as well had an increased level of anxiety, really emphasizing those people who are earlier stage in cancer, recently diagnosed, or later stage 4 metastatic, really having an impact. And from a caregiver perspective, again, 73% had an increased level of anxiety. Again, recently diagnosed and metastatic stage patients, again, had higher levels of anxiety. And those pre-diagnosis, again, 77%. And then 43% overall fear their cancer will progress. 36% overall for patients, again, more so for those recently diagnosed or in the metastatic stage. 68% for caregivers, again, same, recently diagnosed metastatic stage, and 68% for pre-diagnosis. So you really see that the fear for the future, you really see the greater fear for the future among those who are recently diagnosed, pre-diagnosis, and those in the metastatic stage. So this fear of what's going to happen, what can happen to me when I can't get to the doctor, when I don't have my appointments, when I don't have my tests, and maybe when I don't get my treatment as required. And among those who interact with a physician during the pandemic, most, 83%, actually had a virtual consultation. So when we asked what the virtual consultations, we asked, did you talk to your doctor by telephone, a video consult, email, instant messaging, online chat, text, etc. The vast majority said that if they had a meeting, an appointment with their doctor, it was actually a telephone consult. My father is going through is in remission right now. He had an appointment recently with his doctor by telephone, so it definitely is happening to everyone. When we looked at the types from a patient perspective, how did they interact during the pandemic? 85% of patients interacted with their doctor, their family doctor, virtually, mostly by telephone. And most were satisfied. If we looked at them, very somewhat satisfied, 88% they're satisfied. So overall, it felt like they were satisfied with their virtual appointments. And 31% of patients had in-person meetings with their family doctor, and they were satisfied with those as well. And we looked at specialists. So if you're seeing an oncologist, or if you've got prostate cancer, seeing a urologist, 76% of specialist appointments were were virtual, and they report high levels of satisfaction, 92% for virtual, 34% at an in-person visit, and they were still highly satisfied. So even though what we found was that they were satisfied, but even satisfaction with their appointments doesn't mean they're not fearful. From a caregiver perspective, 81% said that the patient saw the doctor virtually, and you can see here their satisfaction was somewhat less than with patients, 75%, and 80% saw their specialist virtually, and 78% were satisfied. We looked at in-person visits. 35% of the GP visits were in person for caregivers, and they were slightly higher, 81% satisfaction. And specialists as well were 31% saw their specialists in person, and they were 100% satisfied. The one thing some of the open-ends that some people wrote in saying that being a caregiver, you're not always in the same location as the patient. So sometimes if they're having a telephone consult with their specialist, and especially if they're in a nursing home and what's happened with COVID, with lockdowns, people can't be at those appointments anymore. So they're fearful that they're missing out on the information that's being told to the patient through a telephone consult. If they can't be there themselves to help understand it, they're fearful they're not getting the full story. And from a pre-diagnosis patients, those who don't know yet if they have cancer, 72% said that they'd had a virtual consult with their GP, and they were pretty satisfied, 80%. And 72% had an appointment with a specialist, again, somewhat satisfied, 78%. And 39% had an in-person visit with their family doctor, and 40% had an in-person visit with their specialist. And they're much more satisfied with their family doctor than their specialist. So you can see here that they do report overall high levels of satisfaction with the types of visits, including the virtual visits. But we see that their fear and anxiety is still high. As we saw, although many consulted a doctor, 71 remain concerned about receiving in-person care, especially those recently diagnosed and pre-diagnosis. So we'll look at this specifically. So when we looked at the different types of care or their concerns, here we have a list of different things. So you can see here that 56% overall were concerned about their ability to receive hospital care if needed. Again, the 56% were also concerned about their ability to be cared for in the emergency room if they were needed. 54% were concerned about being able to get tests related to their cancer done. 54% are concerned about being able to see the doctor managing their cancer for follow-ups. 54% are concerned about being able to get help for side effects related to their treatment or their symptoms. And 51% are concerned about being able to receive cancer treatment in a timely fashion. So you can see that there's a lot of concerns overall. When we look at it from a patient perspective, you can see patients overall across these concerns are from around 50% concerned about everything. Into receiving hospital care, again, you see those who are recently diagnosed or in metastatic stage are more concerned about being able to receive hospital care. Recently diagnosed are more concerned about getting care in ER. The emergency room, again, those recently diagnosed are more concerned about being able to get tests related to their cancer. 61% of recently diagnosed are more concerned about being able to be seen by their doctor for managing the follow-up. Again, 57% getting help for side effects related to symptoms or treatment. And again, more so for those able to receive cancer treatment in a timely fashion. Caregivers as well, slightly more. You'll see here if you look at the numbers all the way down, 67 to 75%. Overall, across the board, caregivers are more concerned overall about the cancer care and the ability to get care for the patients if needed across the board. Hospital care, ER, testing, follow-ups, help for side effects, timely fashion treatment, and more so for those recently diagnosed to be able to see their doctor manage their cancer. And those pre-diagnoses as well, you can see overall higher levels of concern. So we looked at what happened to them in terms of treatment, and here you can see the higher level of concern as well. And we asked them 3 points. So prior to COVID-19 being declared a pandemic and restrictions put in place, how did you feel? Were you anxious? What was your level of anxiety? You can see here the red lines, the patients, the blue lines, caregivers, and pre-diagnosis high being green. You can see here that patients were like 35, somewhat concerned, but you see the caregivers in pre-diagnosis were concerned beforehand, so higher levels of concern. During the height of COVID, you can see that the levels have gone up for everyone, for patients, more so for caregivers, and also for pre-diagnosis. And currently, as restrictions begin to relax and ease, you can see that patients, again, still higher levels of pre-diagnosis prior to COVID, but you can see that caregivers are the ones that are still higher levels of anxiety overall. And we drill down into those numbers a bit more to see what they're saying. We really see that the anxiety levels of these patients, when we asked about their anxiety, really did increase during the height of COVID-19. We had 5 in 10 patients reporting being very or somewhat anxious. We looked into who was the most anxious. As we've seen throughout the study, metastatic patients, 72% reported 72% anxiety level, recently diagnosed, and those with lung cancer. You think about with COVID, they're saying lung, it's impacting the lung more. Lung cancer patients were more concerned and anxious about getting with the COVID-19. About almost 8 in 10 caregivers say they were anxious, and more so for those in the metastatic stage, 9 in 10. So really seeing the level of anxiety during the height of the pandemic, that their anxiety levels have increased. And we saw that those pre-diagnosis patients, 7 in 10 also had, they said they were anxious during the height of the pandemic. And now as restrictions ease, we see that there still continues to be anxiety. It's still elevated from prior to COVID. 4 in 10 patients are higher anxiety than before. Again, with those as metastatic and recently diagnosed being the most anxious coming out of restrictions. And among the caregivers, it's not easing at all in terms of their anxiety from the height to currently. 3/4 of caregivers are currently anxious, especially those caring for patients with metastatic cancer. And again, those with the pre-diagnosis patients, 2/3 report currently being anxious. Even though we're not in the height of it, as restrictions ease, there's still a lot of anxiety among these patients. I've got cancer, I need to be treated. And looking at pre-diagnosis patients, 70% of pre-diagnosis patients are concerned about delays in diagnosing their cancer. We looked at different factors. We saw that 52% overall are concerned about delays in being able to schedule appointments. 52% are concerned about delays in receiving treatment in a timely fashion, and 39% are concerned about delays of availability of new cancer treatments. From a patient perspective, you can see that they are concerned overall. Again, we see the recently diagnosed adjuvant stage being more concerned of patients. Caregivers, again, showing a higher level of anxiety, concern and delays in diagnosis. And those in the pre-diagnosis stage, again, 60 to 68% in delays in being able to schedule appointments, receive treatment, availability of new cancer treatments. So these are all things that are impacting the patients and the caregivers. And specifically with pre-diagnosis patients, we wanted to understand how anxious they were or are concerned about delays in getting cancer diagnostic testing and procedures, and 70% expressed concern here. So these are patients who are getting testing done to see, do I have cancer or not? They are concerned about the delays. So what we saw in the study was that overall, 54%, just over half of patients have had cancer care appointments canceled, postponed, or rescheduled. 3/4 of pre-diagnosis and recently diagnosed patients report having appointments canceled, postponed, or rescheduled. So early stage, you've just been diagnosed, 1 to 2 years, you're in the process of being diagnosed, they've been canceled. That's a huge worry for them. 74% say delays in appointments and treatments have had a major impact on their mental and emotional health, specifically those with metastatic and those recently diagnosed. They're recently higher levels of anxiety. As we saw from the people and what they wrote down, what they felt. They can't eat, they can't sleep. They don't know what it means to have their appointments canceled, delayed, or rescheduled. The majority of patients who consulted a doctor during the pandemic did so virtually. We saw that, but 71% remain concerned about receiving in-person care during the pandemic. We saw many didn't want to go to the ER. They were worried about going to the hospital, getting the in-person inpatient care that they needed if required. And even as restrictions lift, 50% say concerns about receiving adequate cancer care are fueling their anxieties, especially among the pre-diagnosis patients. Here you are, this pandemic hits, you don't know if you have cancer or not, you can't get the testing you want, and they may not know their diagnosis yet. So that was the results of our study. So Mona, if you want to open it up for questions. Are there any questions out there?
Okay, we've got questions. We've got quite a few. So we'll try and get through them all, but remember, Marjut would be happy to answer any further questions by some other means. We'll figure it out. So questions from Rachel. Why do you think there were twice as many males represented in the pre-diagnostic category?
That's a good question. I don't know. It could be that maybe there was more people. I don't know. Actually, I really don't know, and I don't know if I had a really great team working with me behind the scenes here, so I'd like to give a good shout out to them, and if anyone of my team can send me an email, but I don't know why there were more males at that point in time.
Also from Rachel is, how do the findings about people who are waiting for a cancer diagnosis compare with the pre-COVID area? I don't know if we can answer that because we haven't done the survey pre-COVID because we didn't know it was coming. Is that right?
No, and the only stat we have there that really could help there is just like what was there. You can see that on that one slide that their anxiety levels were higher prior to COVID than others. They were similar to the caregivers. So it was I'm just going to look at my paper copy here. So prior to COVID-19, their anxiety levels were 65% comparable to 64% of caregivers versus patients. So they were already high, and then during COVID they went higher. So we don't know prior to this. We've not asked the question. We asked them a question. What did they report? And also the one thing with the pre-diagnosis patients was we only had 77 of those in the study. So it is a smaller sample. So it's harder to speculate.
Okay. Polisha has asked, other than location, was any other demographic information collected? I am curious how these responses may change for different groups such as low income, racialized immigrants, etc.
We did ask demographic information, so we asked ethnography, ethnicity, income levels, etc. And I think we did look at that information, but I'm not sure if anything we could look into that more so. But we did ask the typical demographic questions here.
Next question is
out to us. We can give you more information.
Okay. Next question is from Sarah. Curious to know if you looked at any differences by tumor type throughout this research.
We did actually, and that's one of the points we pulled out was lung cancer. So we did look at the major tumor types: breast, lung, colorectal, and blood cancers combined. And we've got some differences by that, but nothing that we pulled out the one significant point here that really came through. But we do have that information.
Okay. Do you have any insights why the number of concerned caregivers tend to be higher than those of concerned patients?
I think as my father having cancer, I think, and thinking about my father and my mother is way more concerned about his cancer than he is. So you're always, we didn't ask that specifically, but knowing as a caregiver of somebody with cancer, I know that you fear more for them. Sometimes the person going through the cancer is going, okay, yeah, I've got cancer, let's go through this. And some are more, but other times, sometimes the cancer patient, the caregiver themselves is the worrier of the family. That could be one reason. That happens in my family.
And many's. Warren's asks, or he states, the survey figures are meaningless to me. What benefit was achieved in knowing that C19 caused anxiety? Do you want me to take that one?
I would like you to take that one.
Okay. Lauren. We are involved in public policy around cancer in Canada at Canadian Cancer Survivor Network. And the whole point of the survey is to know, besides anxiety, what other, what other issues were brought up by cancer patients because they were not getting treatment, and they are in double jeopardy because they're afraid of getting COVID and they're afraid of their cancer getting accelerated during the time when they can't see doctors. And I think the next question, and we will be sharing that with the governments responsible for cancer treatment. In fact, in an article in the Globe yesterday about our survey, there's very clear recommendations. For instance, why are all those hospitals kept empty? They should have had put COVID patients in one hospital and had other hospitals available for cancer and other diseases or illnesses that needed, more urgent care. The next question may bring up that answer too. How can these survey results be used to share back with institutions that treat cancer and government so they can rectify and course correct moving forward? Thank you for all you do, CCSN. Shall I take that one as well? Yeah, so these survey results have very much already gone out to government officials responsible for healthcare in all the provinces and federally. And we're making some specific requests that pandemic planning at all levels include cancer care and care for other situations that may require a continuity of care that is not been evident during this time. Our message is cancer can't wait. So we are already moving towards that, and that was the purpose of this thing, is to make of the survey, was to make that evident to government by having a recognized number of people and find out really what happened to them, rather than the immediacy of the phone calls or messages we were receiving at CCSN from very anxious people, and people were, worrying they're going to die because they can't get to their treatments, and for how long they didn't know. Marie is asking, do you consider the sample size to be statistically significant? And there's a two-part question. I can repeat it again if you want. How did you gather survey data? Was it primarily online, or were people able to respond by phone or mail? My concern is for people who are less familiar with technology were not represented.
So the survey was done online. And that's typically how we're doing surveys these days. And this, because it's an online survey, we can't say statistical significance, but we could say as it would be if it was statistically significant, this is what the numbers would be. So it is, we do this online. We used our panel. There is a panel of almost 500,000 Canadians that have joined the Leo panel for Leger. And we use that as our main source of getting these people. And then we also provided a link. So it was anyone who was more web savvy, who was online, who would do these surveys. So it's not a representative sample, because we did not do telephone, we did not do any other things. But it is this is the type of survey that's being done these days as well. So I think it does give you a good idea. And if you want to know more about how we got the survey, you can reach out to us and we can give you more details specifically about the statistics, etc.
Okay, next one is not a question, but a comment. I am preparing for an appointment today to see if my immunotherapy is working. While reviewing my CAT scans, noticed that when I was waiting to see if I qualified for immunotherapy, my tumor grew in size. Your study reinforces real concern. I have metastatic lung cancer. Were any of the patients interviewed has ever had any? Oh no, I have metastatic lung cancer. So that's from John. So that's the end of it. That is really a really bad situation, and that's part of the purpose of why we did this, to say the effects and the impact on people. We're going to try and find out later, after the end of this year, if there were more deaths from cancer during this year than all other years just preceding it. So we're not letting go of this. Amidu asked, were any of the patients interviewed has ever had any symptom or diagnosis of COVID-19?
We didn't ask that question. We couldn't tell you.
Okay. From William, will hospital oncologist appointments change as COVID-19 restrictions decrease? I don't know.
From a person, I know my father's appointment with his hematologist was done virtually, and he's got an appointment in the fall, and it's also going to be virtual. He's already been told that. So that's my example.
Brenda is asking, is it possible to get this data broken out regionally?
We have some regional information in the full report. It depends on what we can talk to you as CCSN to see how you want to get this data out to other people.
Okay, we will be doing reports and information. We're doing a special newsletter, a special e-letter this week. If you're not already receiving the e-letter, you can do so. Sign up at www.survivornet.ca. So we're going to keep continuing pushing out the information that we have from the survey as far as possible. Joanne is asking, are you planning to have a future study based on the current conclusions you have found from the present study, perhaps on cancer patients who have developed COVID-19 symptoms? I'll take that one, shall I? Yeah. Joanne, we're still doing planning around the best use of all this information, and where is, depending on when we finish looking at all the data, there's an awful lot there, and all the input, we will be having a planning meeting to see what's the best way forward. After we have also made sure that summaries of the data and the salient points go to policymakers and politicians who have the power to change the situation. So we have the data, it's current now, we're sending it out to have an impact on policy change. Then we will see what should be the next step. We could be looking at that very well, but I'm not sure yet because we haven't got to that planning meeting stage. We're still pushing out the data. And that seems to be the end of the questions. We're almost at the end of our time anyway. So thank you everyone for those excellent questions, and to Marjut for your responses, which were very helpful to people, I'm sure. So thank you everyone, whether you asked a question or not, for attending our webinar on the impact of COVID-19 on cancer patients and their ability to receive treatment. We'd especially like to thank our presenter, Marjut Huotari, Vice President of Healthcare Insights at Leger. We all know that cancer can't wait. The delay and cancellation of cancer care due to COVID-19 has triggered another public health crisis in Canada. To save lives, cancer diagnosis and care must continue during any future pandemics or other public health crises affecting Canadians. Cancer can't be canceled or postponed. Crisis and pandemic planning must explicitly include essential cancer care. We're calling upon governments across Canada to heed and listen to the experience of these people facing cancer and treatment and diagnosis and their caregivers during the COVID-19 pandemic by providing for explicit inclusion of cancer care in all crisis and pandemic planning. This webinar will be available tomorrow on YouTube, and in addition, the slides will be available on SlideShare. Links to both will be sent to the email that all the registrants provided. And don't forget, tomorrow, Thursday, July 16th at 1 p.m., different time, we have another webinar on Canada's new drug pricing rules. What are the implications for cancer patients? Which will be presented by Ryan Clark, founder of Advocacy Solutions, and Wayne Critchley, Senior Associate of Global Public Affairs. Go to our front page at survivornet.ca to register. Thank you all.
Thank you.